have been marking Overdose Awareness Week by looking at a city that has shared a very similar experience as San Francisco. Fentanyl actually arrived in Vancouver before San Francisco. The results have been equally devastating for both cities. We've been showing you all of the different approaches British Columbia has tried to do to save lives there. Things like opening safe consumption sites and providing a regulated supply of drugs for some users. And we've also shown you how the results of those strategies have caused a lot of division and disagreement in Vancouver. So we take you back here to San Francisco. You'll remember there was an unofficial safe use site operation for a little while. The Tenderloin Linkage Center was opened in early 2022. It was operated by contractors for the city. It was originally announced as a connection point to services. It ultimately became a de facto safe consumption site for users, generating some controversy. Mayor London Breed decided to close it down at the end of that year. So, should those be part of the city's portfolio? And what other things is the city trying to get people linked up with to help? Wilson Walker has the last part of our series.
Because I didn't see no way out until they showed up. I didn't think I could do it by myself. I didn't even care if I did it by myself.
Michael is talking about the help he has received from his psychiatric clinical pharmacist, that's Damian Peterson, who's making a house call to deliver this medically assisted drug treatment. Michael says this has been a key part of his journey off the street into stability and working towards recovery.
They helped me taper that off and then kind of balance me out. With the whole Suboxone and then Subucade and whatnot, and it's played a major benefit to my life.
It's no way to do it on my own, but also the support with it is very important.
Tiki is another patient, and like many fentanyl users, she says she can't imagine escaping that drug without something like methadone to reduce the withdrawal symptoms. In San Francisco, has been increasing efforts to take this kind of help directly to people instead of expecting them to visit a clinic whenever it is time for their medication.
Somebody has so many other things going on in life that's making it chaotic and unpredictable. It's really hard to focus on this goal of making it to an appointment.
And after years of climbing overdose numbers in a city desperate for some good news, some is finally emerging.
Comparatively, we have 72 more people alive compared to last year, so I think it's just really important to put the human face on that.
City health officials say they're not sure why, but overdose numbers are falling. Deaths so far this year down 15% from the same period last year.
Yeah, I think we can't point to any one specific thing, frankly, within the department or, in the broader sense that we can say, pinpoint this is the reason.
Because I want to make it easier, just as easy to get treatment as it is to go out there and buy dope.
So what is San Francisco's plan going forward? Well, Mayor London Breed declined to be interviewed for this report. She has in the past supported some of what has been tried in Vancouver, namely safe use sites. However,
we do have some concerns with state law that could lead to not only the arrest of people who are implementing safe consumption sites, but potentially the disbarment of lawyers in the city attorney's office.
Harm reduction, which safe injection sites fall under, can be a small part of the equation. But right now, it's the central part of what we do, almost the only thing that we do as a city government. And the answer is, it's failing.
The drug crisis and its intersection with homelessness is, of course, a prominent topic in the race for mayor. And there is one theme among the challengers. Former Mayor Mark Farrell is suggesting one giant emergency center.
Really massive additional shelter capacity, one place where people can come, but have services connected with that.
For me, a safe injection site, a safe consumption site around fentanyl does not make sense at this point.
Daniel Lurie has also stressed building out more capacity.
What is on the table is making sure that we get people off the streets that are using and into care on demand or mandating treatment, which we are able to do now with SB 43, but we need to build the beds.
Look, there is no one right answer. Harm reduction is part of the answer. Abstinence is part of the answer. Treatment is part of the answer.
Supervisor Aaron Peskin has suggested a regional approach with Santa Clara and Alameda counties.
And work jointly to stand up a facility to repurpose underutilized and unutilized state facilities that have been sitting around for years and stand those up as massive drug treatment centers.
If we want to stop the overdose crisis, we got to get people off the streets and into places where they can have a medically trained professional.
And Supervisor Asha Safai, an early advocate for sober housing, also points to the general need for more.
So we need sober living, we need to expand the number of mental health and drug treatment beds.
So it's a universal call for more treatment capacity that will require resources, and then there are the questions about how to best connect people to help, and should more people be compelled into it.
I wish I could sit down with him and say, look, man, go here, go here, go here.
Michael says the treatment he is receiving has changed his life, and as for how to get more people connected to that help, he says a lot of users just do not know where to start.
I just wish they were educated more, you know, and there's some very intelligent people out there, but they don't know what to do.
Wilson Walker joining me in studio now. And while the silver lining is something is working, it's just the what exactly is it? Maybe it's just not a one-size-fits-all. It's a number of things working.
Right. You think about how many things are maybe playing a role in what is happening. We showed you one of the sort of methods they're using to try to get people some help. There's also been a law enforcement crackdown going back about a year that has intensified. Does that have something to do with it? Maybe it's something even more simple than that. We can show you some video from inside one of the city's public, sort of affordable housing developments. They're finally putting naloxone in those buildings. Remember, most of the city's overdoses have been coming from inside these buildings as opposed to the street for quite a while now. So they're finally getting naloxone inside these buildings where they are putting folks who have come off the street. Many of them do have substance abuse challenges. So maybe it's something as simple as that. We just don't know.
Well, let's talk about the November election, specifically the mayoral race. It seems like every candidate touting their plan, but it's not just one idea. It's 3 or 4 or 5 to make this whole thing work. So where does that stand when it comes to election time?
Well, it is obviously complicated. It's obviously going to dominate the conversation as we move towards the election. And remember last night we were talking about the gravity of some of the questions involved, right? Personal freedoms and what can we do to people in public spaces and where does individual freedom end and collective responsibility start? These are profound questions. And it's worth pointing out that the city has been struggling with this for so long.
Right, it's not a new problem.
It's
not new to this election either.
And as people run out of patience, you can tell people are clearly looking for answers and pushing for answers. And like we said, this is really going to dominate the discussion through November.
Yeah.